Okay, Joey, Denver Public Health released a new study this week analyzing gun-related deaths and injuries. As reported by the Denver Post, the study revealed the highest rates of gun homicides impact black men and women ages 15 to 24, and those occur 5 times more often than with whites. Meanwhile, whites are more likely to die by suicide by a gun than blacks are. What do you see with these apparent inequities?
I've read so many studies, I'm just blind to them at this point. You know, every study that comes out, both sides can spin it one way or the other. I'm surprised the NRA hasn't already had a press conference saying that black people should buy more guns because they're more likely to be victims of these crimes. You know, I don't know what moves the dial. If 26 dead people in an elementary school, 20 children in an elementary school in Connecticut doesn't move the dial, I don't think this study moves the dial. It only comes down to 2 questions. Are you for it or are you against it? Nothing else matters.
And Ben, what do you think about Denver Health commissioning such a study?
I think it's interesting. I mean, it's certainly good for Denver Health to understand the population that they serve. You know, there are sort of private jokes in that hospital about the Knife and Gun Club coming through on Friday and Saturday nights in particular. So they are the only level 1 trauma center in the city of Denver. So like I said, I think it's important for them to understand it. I think when you dive into the numbers, there's nothing particularly shocking there. I think it's reflective of broader national trends. I think also sometimes focusing on the use of a firearm, particularly for a suicide, is not necessarily the best picture of what's really going on in the world. So I think it's a very small sliver of information that I trust has some use for Denver Health, can paint a little bit of a picture for those of us that care about these things in society, but I don't think there's anything particularly illuminating about it.
Noelle, since I almost snubbed you last round, let's expand this a little. You just did that really interesting story about Leon Kelly and the gang deaths in 2015 and what they did to try to have no gang murders at all in one part of the city. What do you think about that? Because that's certainly the age group we're talking about in this study.
Yeah, absolutely. The Denver Health study, said that it affects 18 to 24-year-olds, and then I guess we should say 18 to 34-year-olds because they broke it down to both of those age groups, and it is the second leading cause of death in both. So 2015 was a really violent year for Denver, a lot of gang homicides. The city's homicide rate hit a 9-year high 2 years ago. And just back in April, there was a shooting at 28th and Arapahoe that was gang-related. Sent a lot of chills, like, uh-oh, here we go. This is the kind of thing where we start the tipping point for the back and forth that can go on all summer. Let's get control now. I remember going to a luncheon with the Reverend Kelly back at the beginning of the summer, and you could see that he was really upset and agitated. And he called people together, and they put together a plan, and they decided to concentrate on a small area that was the center of the war zone in 2015, and said, okay, we're going to prevent gang-related deaths in this. It was Downing Street to Colorado Boulevard, 29th Ave to 40th. And we're going to hold it down here. And so they did stuff all summer, all over in the weekends, wrote books, played games, read books, rode bikes, played games, had barbecues, invited parents. Those neighborhoods are going through gentrification. They brought in as the Rev calls it, the new hood and the old hood, had people talking and meeting with each other, and they announced earlier this week that they were successful. That doesn't mean there weren't any homicides. Denver's homicide rate this year is actually on track to even surpass last year, which hit a 10-year high. So it doesn't mean that homicides are under control in this city at all. Gun deaths are not under control, but there was an effective plan in a very small, concentrated area.
Yeah, back in 2015, there was a shooting right outside here, and there's still a little shrine there. Michael, gangs, guns, wrap it up for us.
Yeah, so I think the stat that really hit me with this study was the 15 to 24-year-old range. And part of that is because I'm a former school teacher, and a lot of the kids that I taught are around that age now. And I grew up in Chicago, too, so where gun violence is obviously devastating. I think one good stat out of it was Denver is in the bottom third of big cities when it comes to gun violence. But, as we know, one homicide is too many. And Bill Berman, the ED of Denver Public Health, said 2 things that I agree with. One, that we need to do more to educate people about handling firearms the right way. But the second thing is that they need to do more about addressing mental health issues, and that is a big issue that is it has a lot to relate to these things. So I hope this study really creates an ongoing discussion about this issue.